Children's Minnesota is coming up on 100 years of championing the health needs of kids in this community. As we approach that milestone, we're taking steps to ensure that we can change in ways that best meet the changing needs of those kids and families, of a community that looks very different than it did back then, and of a rapidly evolving healthcare environment. Now, as I've shared before, we don't have all the details about each of those changes yet, which naturally invites confusion or speculation. So I want to be clear about changes that will impact the St. Paul campus. We are not closing the hospital in St. Paul. We are not phasing out the hospital in St. Paul, and we are not selling the hospital in St. Paul. We are as committed to the children and families in St. Paul and the East Metro area as we were when the first children's hospital in the Twin Cities, the precursor to today's Children's Minnesota, opened on the corner of Smith and Walnut in 1924. What we are doing is creating a new campus experience, ensuring that the vast majority of children in the Twin Cities can have their healthcare needs met right here at home. That means that both the St. Paul and Minneapolis hospitals will provide a broad range of the lower acuity services kids most often need, including emergency, outpatient, observation and general inpatient, and surgery. We will continue to have an emergency department that is a level 4 trauma center in St. Paul, just as it is today. Our level 3 NICU in St. Paul and our mother-baby center will be unchanged. We will provide infusion and sedation and procedural services, just as we do today. And we will continue and actually enhance our ability to provide care for short-stay medical treatment, sometimes called observation services, which account for the vast majority of hospital stays for acute illness, such as asthma and dehydration and other conditions. Now, some children, of course, have more significant medical needs, requiring highly complex, specialized services, the kinds of pediatric specialty services we're known for. We're proud to be able to offer many of those services at Children's Minnesota. These are the kinds of services that children in other communities often have to travel hundreds of miles for. Currently, most of these highly complex services are concentrated on our Minneapolis campus. Programs such as our cardiovascular program, cancer and blood disorders, our fetal care center, level 4 NICU and ECMO, and others. While we have a handful of highly complex services based in St. Paul, it's unusual in a metro area our size for a children's hospital to offer such highly complex services in multiple locations. Most bring them together. For example, our peers in places like Seattle, Milwaukee, Columbus, or Kansas City. So we are moving toward consolidating all of these services into a single location in Minneapolis. As I've said before, every change we will make is about the kids we serve. This consolidation will allow for better and more efficient care through standardized clinical practices and workflows, and sharing of esoteric and often expensive equipment and personnel. Bringing multiple specialties together in one location is also better for the families who require multiple specialties. Consolidating our high complexity, high acuity services will enhance those services for kids and families throughout the entire region, allowing us to provide world-class care right here in our community. I ask you to engage in this work of redesigning that hospital experience across our campuses. You know, as we celebrate service anniversaries this month, I know many of you have been here for 10, 20, 30, even 40 or more years. And that changes to what you do, to how we serve our communities, to what work is done where, those can be really hard. And for us at Children's Minnesota, change is even harder because our work is very personal. It's rooted in a strong commitment to our patients and families and community. Now, Children's Minnesota needs to change, but to be successful in that change and to be here for kids, we will need that same level of commitment. We're changing so we can serve kids better. We're changing to serve more kids, to serve them well into the future, and to serve them better regardless of where they are, whether in Minneapolis, St. Paul, Wisconsin, or anywhere in the Midwest.